because the biggest thing is you deserve care in a safe environment with dignity, with respect. And if it doesn't even feel safe to speak up early on, to ask questions or to ask about choices, then that might be an indicator for you, because you're the expert on you. You're the expert on your body and what feels comfortable to you.
Welcome to the Birth Education Center podcast, hosted by myself, Care Messer, an entrepreneur, birth educator, and doula. My team and I want to help you discover your options in birth and postpartum, how to find your voice, and how to use that voice to navigate our maternal healthcare system. You and your baby are not just a number. This information includes doulas too. Now let's get started. I have Beth Warren on today. Today's show is going to be about mental health for pregnancy, for postpartum, PMADs, all sorts of things that you probably don't even have words for yet. And Beth has been doing this for 25 years, probably over 25 years now. And she's certified in EMDR therapy, which is a therapy I have used, which is phenomenal. She even trains therapists on that. She's written 2 books. I'm going to read them so I don't mess their names up. One, obviously, because I use this one, is the Pregnancy and Postpartum Mood Workbook. And most recently is Healing from Reproductive Trauma. And we're going to do a whole episode on that book coming up soon. But together, Beth and I created last year an online class for pregnancy and mental health, because I was finding with my students that they just aren't well informed on mental health before they get pregnant. And while they're pregnant, there's so many changes that families need to understand what's coming, how they're changing, and how to get help and manage what happens with their moods, their hormones. And if you guys understand that during pregnancy, it makes a huge difference in how you're recovering postpartum wise, because you actually have language around it. And Beth's workbook is so phenomenal. It comes with the course. Everybody should have it. It should be given as a shower gift. That's how much I love this workbook. I mean, Beth, you know I'm a fan of it, but it's like college level. It's so well laid out. It's beautiful. It's easy to understand for the layman like me. And it has helped so many of my families manage things that they didn't know they were needing to manage. And it really helped them going into the postpartum. So it's a phenomenal workbook. I will link it in the show notes, as well as that online class. Welcome, Beth. Thank you so much for agreeing to come on today, because I know how busy you are.
Thank you, Care. Thanks for having me. And you're a tremendous hype woman. If I'm ever having a bad day, I should just call you up. You're like, do it again. Thank you, lady. I'm glad to be here.
A huge cheerleader, a hype woman. That's another t-shirt I should make myself.
Thank you. Hype woman. It's great to be here and right back at you. All the things. I'm so grateful for everything you do. So thank you.
I feel the same way. And for those of you that are watching on YouTube or on video, I thought Beth's background was a fake background because it was so perfect and so pretty. And I was like, wow, I've never seen that background before. She's like, thank you. It's my office. And I was like, oh, it's so pretty.
It's real.
It's real. So maybe I need some therapy, because I could really relax in that room. I think I really like it. So let's start for our listeners by telling, just your story. How did you come into doing this kind of work? Because it's truly your passion. And I just want them to understand kind of where you're coming from with it.
Yeah, that's easy answer for me. When I started my career, I was a little baby social worker back in the 1900s in a maternity ward at Scripps La Jolla. And I worked on labor and delivery in the NICU, postpartum, and I just absolutely fell in love with the work. And of course, as a clinical social worker working on a maternity floor, for anybody who's been familiar or ever seen a social worker when you're on that floor, typically I was called in whenever stuff went south and whenever there were difficult issues, whether somebody's baby had gone to the NICU, they had had a loss, they'd had a traumatic birth, et cetera. And so while I certainly had a heart for the work and a heart for working with people, I found over time that I really became hungry for people's full story and not just the crisis intervention at the beginning, but really wanting to work with them throughout their entire journey of healing, or longer journey of healing, I should say, maybe not even entire, and not just the beginning initial crisis phase. And I love the multidisciplinary team approach. I loved working with doctors and midwives and nurses and just all the team. But again, I just really wanted to dig deeper and go longer term with folks. So I had started a postpartum support group at one point and loved that work. And then I started my own private practice kind of midway through, and that's what I really enjoyed. So I've had a private practice pretty much ever since and specialize in reproductive mental health, reproductive trauma, pregnancy loss, folks who are going through infertility and fertility struggles, et cetera. So anything reproductive related.
Well, and I think that you first came across my radar when I first came into birth work, because you were the president of the Postpartum Health Alliance locally at that time. And that is one of our best resources, not only here, but nationwide, the Postpartum Health Alliance. So you can look that up.com. And you were doing so much good work with not only the community and informing us what we should be looking out for as doulas and birth workers, but with parents and getting them to understand that mental health, because now we actually talk about it. Back then, we weren't even talking about it. Now we can actually find articles on Google and people are actually bringing it into the forefront of what we need to prepare for. But I appreciated that you were doing it way back then. And that's kind of what got me online to be looking for stuff with my students.
Oh, thank you. Thank you for saying that. It's so true. I mean, I just am constantly talking about it and shouting it from the rooftops. And I have a great admiration for anyone who came before me who was doing the same. Yeah, postpartumhealthalliance.org, by the way, not .com, but is a local organization in San Diego. And the mothership organization you can think of is Postpartum Support International, literally international. So if you are ever looking for a perinatal mental health therapist, psychiatrist, support group in another country, in another state, that would be the place to go. But yeah, it's all about sharing and spreading awareness so that we can help destigmatize perinatal mood and anxiety disorders, help people access free and accessible care. So yeah, it's a huge passion of mine too. Because if you know what to expect and if you know how to seek support if something changes for you, it can really help take out some of the guesswork and the challenge, the slogging through looking for a provider. It's already hard enough on top of whatever else you're struggling with.
Yeah, I definitely want, even in my Oh My God, I'm Pregnant course, I have, please get a therapist. Because if you have already done all the legwork to see who your insurance covers and who's available, and you already get on their call sheet ahead of time and do 2 sessions, then afterwards they have a baseline for you. And then if you need them, you know they're covered by insurance, you know you can get on their schedule. Because how many of my moms are calling and they can't find anybody and they're sobbing and they need help right away. And if you already have that relationship with somebody, it's so much easier. It's easier for your family, especially if your partner ends up with some postpartum depression or a mood disorder, because that can happen too. And we'll talk about that a little later. Can you talk about, because we talked about this earlier and I want my listeners to hear this, you come from a trauma-informed background and look at your clients with an attachment lens. So what does that mean?
Yeah, I'm so glad that you ask. And I just encourage anybody, by the way, that you can always ask this of any of your providers, not just your mental health providers, but also your birth providers, your primary care physician, anybody. You can always ask them, what does it mean to them to be a trauma-informed provider? Or you can even ask them about their experience with implicit bias trainings or culturally sensitive trainings, et cetera. It's okay to ask these questions. I think sometimes as informed consumers, we might be afraid to ask those questions or afraid to have those deeper conversations, but it's a-okay. Just like we're asking them about specialties or maybe looking on their website about specialties, it's important that we ask those questions too if one of the things that you are seeking help for is trauma. Trauma-informed care isn't a certificate, or it's not like a training that you've been told, though there certainly are trainings about it. What it means essentially is that you are providing culturally informed and sensitive care. It means that you are providing agency to your client, that care is collaborative. It's not a top-down kind of care like I'm dictating what we're doing. It's much more like I'm going to describe to you my recommendations, and this is my treatment suggestions.
Some shared decision making.
Shared decision making. Informed consent is more than just a piece of paper. In other words, it's me describing, this is what I'm recommending. Does that make sense to you? It's going to be an ongoing conversation. You can always say no. You could say, kick rocks, lady, like this isn't going to be a good fit for me. But I too can say, these are my suggestions. And if that's not a good fit, that's okay. Like it is a collaborative, we got to make sure it's a good fit kind of thing. And that's why I say it's not just with mental health clinicians, but that's the idea of giving choices, and that it's okay for you to say that doesn't fit for me. And to either, like I say, find another provider, or to find your voice in that care to say, what other options do we have? Break it down for me. Because the biggest thing is you deserve care in a safe environment with dignity, with respect. And if it doesn't even feel safe to speak up early on, to ask questions or to ask about choices, then that might be an indicator for you, because you're the expert on you. You're the expert on your body and what feels comfortable to you. You may not be the expert on, I don't know, mental health care, or you may not be the expert on cardiothoracic surgery or whatever, but it's okay to ask questions. So that's kind of the idea of what trauma-informed care is.
And so explain the attachment lens part.
Yeah, so working with people through the reproductive journey, all the way up from trying to conceive through postpartum, becoming a parent, parenting challenges, etc. An attachment lens means looking at your own attachment style and how you were parented, and seeing how that might inform various stages throughout. So what that might mean is challenges and attachment ruptures that you had. Did you get the things that you needed throughout your developmental stages? Or were there some disruptions? Were there some needs that were not met that, of course, are not going to show up as you are trying to become a parent? And it's really common if you are yourself struggling with your mental health, or you had a traumatic birth experience, or you have a challenging postpartum experience, or your baby's going through health issues, that you are going to then be triggered and activated in certain areas, just period. But then especially maybe if you find touch to be overstimulating, or if you find closeness to be really difficult to tolerate, for example, or if you view closeness as neediness, for example, or vice versa, if you really are wanting touch and closeness and you have a child that is not wanting that, etc.
Beth, that is such important information. I think on some level I knew that, because I've, working through my own 80,000 years of therapy, because that's how old I am. But
same girl.
But when parents feel like because I've heard that from parents and I haven't made that correlation. I don't want this kid on me all the time. I feel touched out, which that's a normal part, but they feel like they're a bad parent. They're not bonded with their kid. They've done something wrong. And if you can just step it back a little bit to how they were nurtured or not nurtured, and they understand that, then they go, oh, I do see it as neediness. Like my mom saw it with me, or I do. Oh, okay. And then they can start to reparent themselves to figure out that they're not a bad parent at all. But oh my gosh, that would, I don't know why I haven't correlated those two things. Duh. I need another year of
there's
therapy.
No duh. No, truly there's no duh. We are all doing that at any given moment. The idea of reparenting ourselves and trying to give ourselves what we didn't have from childhood, but it especially can show up during these developmental stages with your own child, or even in trying to become a parent, etc. So yeah, it's a very common thing. It's some of my very favorite work to do with clients, just because I think it is breaking multi-generational patterns. It's kind of the simultaneous one glance towards the past while also one glance towards the future. It's very rewarding, healing work. I think it's beautiful. I have an entire chapter devoted towards that in my second book, the Healing from Reproductive Trauma book. And it was funny when I first wrote that chapter, it literally was 3 times the length of all the other chapters. And when I was sending it to colleagues to read and give me feedback, everybody was like, Okay, so great chapter, but
Do you want to just make a whole book about that? Because
totally. Everyone was like, clearly you're passionate about this, but I don't know. Everyone's going to want to do such a deep dive. It was like, oh, good notes, good notes. But yes, I love this work.
Yeah, as I'm writing my birth book, I'm having the same problem. Ooh, that one's 25 pages longer than everything else. Let me dial that back in. Let me take a couple stories out of there. And this is one stat that I am not proud of in America, and nobody else seems to be bothered by it at the top in our capitalistic, patriarchal medical care system, that 1 in 3 birthing people will experience birth trauma. That to me is absolutely ridiculous, uncalled for, inexcusable. And I also feel like if we're the ones going to birth that system, we need to understand that before we walk in so that we can help prevent it. And not only help prevent it, but safeguard ourselves with the right support, the right provider, picking the right hospital, birth center, whatever it is, because some of it can be prevented, not all of it. Obviously, I want you to have a really good birth education so that you understand the system, how your body works and how physiological birth works and all of that. But can you talk about what birth trauma is or is not, and then what we can do to prevent it?
Yes. And I love all those questions and all those things that you just said. And one of the biggest things that I think that you mentioned that is so important to highlight is that idea of prevention. And one thing I'm going to add is the idea of controlling the controllables, what is within your control, and that the idea of some birth trauma can be prevented and some is going to be out of your control. And I don't say that to scare people, but actually to destigmatize and deflate the shame. I don't know if deflate's the right word, but this idea of, I have so many people who come to me that say, I thought I was prepared enough. I thought I had this rock solid birth plan. I'd hired a doula. I had done all the childbirth classes. Like, why the hell then did I have this traumatic birth experience and this internalized sense of responsibility and shame and I failed kind of thing? And that's what I just would want. If anyone takes away anything from today, one little nugget is that you did not do anything wrong. So much of birth trauma is frankly subjective and is oftentimes this sense of powerlessness or can be a negative interaction with a provider. And it doesn't have to be a traumatic birth experience from a physical standpoint or an emergency situation that happened or something that happens with an intervention that's needed for the baby or a negative outcome, all those certainly can add to somebody's experience of a traumatic birth. But also 60%, for example, of women who had a traumatic birth experience report that it was because of a negative interaction with a provider. So that just explains to you the subjective nature of birth trauma. And so when we're thinking about things, what can you control? What can you not control? It's really helpful to think about what are the things that put people at higher risk for birth trauma. One is having an untreated mental health disorder of any kind, but especially depression and PTSD do tend to be major risk factors. And so that right there is controlling the controllable. If you have any sort of mental health symptoms that have been untreated or you've not yet dealt with, boom, right there. That is something that would be so helpful. And one of the reasons why is a fear of childbirth can be a major contributor to having a traumatic birth experience. Because going into delivery with anxiety, powerlessness, heightened fear really can contribute to a person's negative experience. And so if you, for example, seek out mental health therapy during your pregnancy or even before trying to conceive to try to get more empowered support, that can be really helpful. Same thing with hiring a trauma-informed doula, helping prepare for feeling more informed and using your voice. Those things can really help prevent and mitigate. So there are certain aspects that can be really helpful. You're so right about the 1 in 3 thing, and women of color are at particular risk, not because of being a person of color puts them at higher risk, but because of the systemic inequalities and implicit bias. And so for people of color in particular, hiring a doula, a midwife, those aspects can also help prevent and mitigate some of those risk factors. So I feel like I'm going on and on, but some of these things can be really useful. Also in my book, I have a whole chapter on prevention and pregnancy and postpartum planning, because this is a biggie.
Yeah. And what's the accessibility for people of color? Because I know that's even something else stacked against people of color when it comes to mental health and hiring somebody beforehand, whether it be a doula or a therapist or whatever.
Yeah, I think that's really important. And of course, we're both white women talking about this, so it's important to name that. Accessibility isn't just also about accessing care, but accessing safe, equitable care, maybe somebody that even looks like you, that you can identify with, but also someone that is going to provide quality care. So when we're talking about perinatal mental health, for example, it's not just that you're accessing anybody that takes your insurance or anybody that has an opening, but somebody that also is going to understand what you're dealing with and not misdiagnose you, overdiagnose you, pathologize what you're going through and make you feel badly, address your pain, which is a huge issue for people of color, et cetera. So there's multiple ways of looking at this, but sometimes I think just even naming some of the inequalities are really important. And that's why when we're talking about prevention, I always like to say, I don't want to put the pressure on the individual to do all the prevention and mitigation management themselves. We also, as a society, to your point, why are we not talking about this more? We are continually calling upon healthcare system legislatures to continue to change the broader landscape, for lack of a better word, because it shouldn't just fall on the individuals to prevent their own traumas.
I mean, we even just not having an appointment after we have a baby for 6 weeks, right? We're checked on really quick for 2 and then 6 weeks. And then that doc goes, yeah, it's normal.
Yeah.
It's normal. And then you just feel horrible and feel like even a worse parent. And then you put off getting help. And let's talk about PMADs and perinatal mood disorders, because the buzzword is postpartum depression and baby blues. And that's really all we hear about. And then all of a sudden this word comes of PMADs, and they're still just talking about postpartum depression and baby blues. So can you give me the scoop on here's baby blues, here's the normal of that, here's where it leads to postpartum depression, and then get into the new word that we should all be using.
Yeah. Yeah. And I do want to reassure anybody who's still using postpartum depression or baby blues. It's not like you're doing anything wrong or that's like un-PC or whatever. It's more just why are we using this more inclusive term of perinatal mood and anxiety disorders, or PMADs? It's first just to be accurate. Baby blues truly are just a normal hormonal adjustment that almost everybody goes through. The stats are anywhere between 80 to 100%, depending on the study that you look at. And it's that idea of it only lasts up to 2 weeks postpartum. And it's that idea of hormones that are adjusting. Man, you're getting used to sleep deprivation. You're also healing physically. It's a lot that you just went through. So it is very common to be tearful or to have mood swings, but nothing, this is the biggest, nothing that impacts your functioning, nothing certainly that includes thoughts of dying or harming yourself or anything, like I said, that impacts your functioning. And so when people are using the term baby blues when a person is 6 months out or has such significant obsessive compulsive symptoms, et cetera, I just want to tear my hair out, because that is not baby blues. Baby blues, again, just up to 2 weeks. It's that normal hormonal adjustment. It's mild to moderate, and it ends. Perinatal mood and anxiety disorders, on the other hand, is this umbrella term to capture any mood changes during the pregnancy or postpartum period that last longer than the 2 weeks. And it can be perinatal anxiety, perinatal depression, perinatal bipolar disorder, perinatal obsessive compulsive disorder, perinatal psychosis, and perinatal PTSD. And so the reason why we're not saying postpartum depression anymore is that it doesn't always start postpartum. And there's a lot more than depression. But yeah, it can totally start during your pregnancy. And so oftentimes people who have only heard postpartum depression and then their symptoms are starting, let's say in their first or second trimester, they're like, what the hell is this? And what's wrong with me? But then also if your symptoms are much more like intrusive, worrisome thoughts, or maybe you're starting to notice significant mood changes, like a bipolar presentation, and all you've heard is depression, you might wonder like, well, what's this? And maybe I'm not going to speak up.
And I didn't. I had a severe OCD when I was pregnant and also really bad intrusive thoughts. And it was just keep it quiet because they're going to think you're crazy. And I suffered with it. And now I'm like, if I'd only known, I just didn't know. And I have families that come in and they see me at the end of their pregnancy, third trimester. And I'm like, oh, if you just had had more, you would have enjoyed your pregnancy because you would have had tools and you would have had help. So yeah, important to get that information before you're pregnant or during pregnancy.
Yes. Kara, thank you so much. Every time you share your story, I think it's so brave, but I also can't help but think of who is listening. And even if it's one person listening that then finds solace in that and inspiration to then go get their own help, it's really lovely.
We just don't have to suffer. And I think we don't even know we're suffering. I mean, I remember hiding that and I didn't tell my husband, I didn't tell anybody because I was so afraid from my own, right? Your own background of how you were raised, because my mom had mental health issues. So immediately I thought they're going to lock me up or they're going to take my baby away. And I waited a long time for her, so
yes,
you have to have people you can trust to help you through that, because I wasn't schizophrenic. I wasn't bipolar or anything like that, but I thought I was. And so I thought, just keep a brave face and hide it from everybody. And it was torture some days.
Yes, absolutely. And that fear response is so understandable. When you are suffering and you don't feel like yourself, it's really understandable, just period, that you would be questioning like what the heck's going on and have a kind of shame-based response of like, I don't want to tell anybody. But you named something really crucial, and that idea of I'm really fearful someone's going to take my baby away from me. And there, I think, is so much validity to that, because I wish I could tell you that that's never happened. But that's also one of the important reasons why it's vital to see someone who specializes in perinatal mental health. In fact, after my name, I have a PMHC, and that shows that I'm certified in perinatal mental health. And for anybody looking for a mental health clinician that has a specialty in perinatal mental health, that additional certification can be a really helpful distinguisher to show that they have had specialty and additional training and are certified. Because to your point, you're already going to be fearful of that, but it's helpful to know that this person is not going to be jumping to conclusions. They're not going to be conflating intrusive thoughts with wanting to harm the baby. And frankly, even if you did have those urges, it's still not a reason to take your baby from you. It's a reason to get in there and help you and get you help. Because all of these, by the way, every single perinatal mood and anxiety disorder that I mentioned is treatable. These all respond really well to treatment. They are not your fault. Anybody listening, this is not your fault. You did not do this on purpose. Who would ask for this? But these all respond well to treatment, no matter how far out you are. I sometimes have people come to me who are months, maybe even years later, they've been suffering, and you deserve healing, no matter how long this has been.
The thought of someone taking my baby after, 6 miscarriages, I had worked really hard to get that baby, right?
Yeah.
My intrusive thoughts would tell me all the different scenarios that it could happen. My baby could be raised by my mom. My baby could go live with my husband's family. And I see how it blossomed into something so much bigger, which kept me in more shame and more quiet. If I had known, because you're right, everything is treatable. And just getting that support, I would have been like, oh, I'm not crazy. I just I'm feeling overwhelmed by these emotions and I don't know where they're coming from. And it's all my reparenting stuff that needed to happen.
Yeah. I think that it speaks volumes to the type of protective parent you are, that those fear thoughts were jumping in about someone taking her. But no wonder then people often avoid getting help. And I hear that all the time. And that's why I say it's so helpful to see someone who knows these symptoms and who knows that it responds to treatment, so that then you don't even have to go through the horrible hoops of explaining yourself and then having someone respond in a way that's not helpful.
Well, and I think if 2020 had a silver lining, very tiny silver lining.
There were a few.
There are a few.
Very few.
But that so many therapists are now online. So if I needed someone with that specialty, it's going to be easier in my state to find it. It's hard to jump states because they need licensure in whatever other state, right? But it's going to be easier for me to find it in my state because they can see me online. And when I have a newborn baby, so say I see them during pregnancy, I could see them in person. But when I'm breastfeeding and I have a crying baby and I can still make my therapy appointment online, phenomenal, because they don't care if you breastfeed while we're talking. Like, we're trying to get everything as stable as possible. So you do what you have to do. So that has been really helpful for families in my line of work.
Oh, for sure. Yeah. And especially if you are in a more remote area or you're from a small town. And frankly, if there's only a handful of mental clinicians nearby or not nearby at all, man, you're right. It was an absolute game changer. It helps to be able to see a specialist, and whether that specialist is a mental health therapist or a psychiatrist who prescribes and knows pregnancy and postpartum backwards and forwards. Man, it's so great to be able to stay, like you said, within your state, but expand the catchment area.
Well, and what does getting help look like during pregnancy?
Yeah, good question. You brought it up earlier that you can do so in a preventative way. You do not have to be suffering. I have a number of clients who come who truly want to do a pregnancy and postpartum planning, just maybe a handful of sessions or a couple. Yes.
It makes such a huge difference because they're talking to an expert. You have worked through all these families, things that have come up for them and how they've sabotaged or in-laws have sabotaged or whatever. Your postpartum planning, the mental health side, is as good as, I think it's even more important sometimes than even having a postpartum doula to help you do that.
Yeah, well, it's a village, right? Like, if we can all help and have our own lens point, and with the sign release, your doula and your therapist can also talk. Your doula, your therapist, your OB, your midwife can all talk. It's really great when there can be collaborative care. Your physical therapist, your therapist. It's really neat when we can all work together. So you can absolutely do some preventative appointments, whether it's because maybe you have a family history of mental health issues and you're like, I just want to be aware. What should I look for? What can I be doing preventatively, mind, body, health wise? Or maybe it's because you are noticing some symptoms and you're just wanting to address it. Maybe there's communication issues with you and your partner. If you're partnered, maybe you're wanting to collaborate in terms of, how do I communicate with my family members who are maybe starting to become intrusive or who I have known to not necessarily respect my boundaries, yada, yada. You can do all sorts of appointments ahead of time. And like I said, do not have to be suffering. But certainly if you are suffering, you do not have to wait for it to get to a certain level. Sometimes people think that therapy is only there for those who are really struggling, moderate to severe levels, or for those whose functioning is really impacted. And that is absolutely not the case. In fact, just like anything, you can go to the emergency room for your health care, but isn't it so much easier when you're staying on top of stuff? And mental health care is the same.
And I think we need to talk about it earlier so that the stigma does go away. Now you can hashtag prenatal mental health or postpartum mental health or things like that and get a lot of good feedback from people who have gone through some stuff and then gotten help. But I think even with childbirth education, we need to be talking about it way more before we even see parents, so that they have it in their mind that that is a check that is just as important as getting a massage, getting a chiropractic appointment, whatever. Because even if you see them 2 or 3 times and you've got 18 visits left in your insurance, that gives you a baseline. They know where you are now. And if there is something, you can address it. But baseline wise, they go, oh, this has changed drastically from when I talked to you 3 months ago. It just makes a huge difference. And it has really comforted a lot of my families that have actually taken me up on that. They don't always, but when they do take me up on it, I usually get feedback about it.
Yeah, and that's, I think, why you're such a trailblazer, Carrie. I so appreciate that you see mental health as integrated as like a full comprehensive part of people's planning for having a baby. And I totally agree with you. It's not a separate thing over here that only some people should access, or that it's only for the privileged, even though certainly that can be the case sometimes for people having difficulty accessing equitable and safe and effective care. It is part of the full comprehensive treatment plan. 1 out of 5 birthing people will develop some sort of mental health symptoms, whether, again, it's the anxiety, depression, OCD, all the things that we mentioned before. And with 1 out of 3 experiencing a traumatic birth, just notice how common these experiences are. And I don't say any of that to scare you, but more just to say, like, if it happens to you, you didn't do anything wrong and you deserve care. You deserve help. And so let's help give you ideas for how to do that.
And we have studies showing that Pitocin can contribute to exacerbating those symptoms. And that's something not talked about, especially as a risk when we're putting them on it for induction or whatever. I know when my parents have known that, I had to take Pitocin because my labor stopped or whatever. I feel so guilty for it. That's why I'm depressed. Not necessarily. There's a lot that went on with that birth. There's a lot that went on with, once again, your attachment, how all that stuff is going. Like, there's so many factors. You can't just blame it on it was the medication I took. But you need to understand that's a risk factor that nobody talks about.
I'm glad you're bringing that up, because there's so many people that have, of course, birth preferences and have an idea of how they'd like things to go. And when it doesn't go that way, will legitimately grieve the birth that they'd wanted to have. And sometimes, and more often than not, then turn internal in terms of blaming oneself. And especially then when there's lingering mental health symptoms, especially if there's any sort of physical healing that's gone south and is really challenging, especially if there's like pelvic floor injuries, et cetera. And I just throw that out there to say, there's no magic words for me to say, this is not your fault, the end, and you're going to feel all better. But this can actually be part of your therapy afterwards and your healing afterwards, is to help uncover what is the narrative you're saying to yourself. It's my fault, I failed, I'm defective, etc., and help unpeel those layers and work through them. Because I wish that you and I now had these magic words to make it all better for everyone. And certainly it can be helpful to be aware of those, but this also can be part of your individualized healing experience, you know?
And if they don't get help, can you tell us what are the results of not getting help? So you just power through and then you have another baby and you bring all that forward with you, right? Because I have that come through classes too. And just because you didn't take a birth class last time and now you're going to take one this time, it's not going to fix what happened last time. And you haven't even worked through last time. So you're literally bringing that suitcase with you every day to class. I can't fix that. So can you talk a little bit about why we even need help after the baby, even if we feel like now we're stable again, why we still need to work through that?
Yeah. All right. So I'm going to start with the bad news and then I'm going to go with the good news.
Okay.
So anyone listening, hang in, because it's rough at first, but I am not a fear monger and that's not my jam. And I don't like to motivate anyone with fear. So stick with me. Here's the bad news. The bad news is, to answer your question, untreated perinatal mood and anxiety symptoms can absolutely, yes, roll into a subsequent pregnancy. They can impact even the thought of whether or not to have another pregnancy. For some people, it informs that they're not going to have another pregnancy because they're still so impacted by their mental health symptoms that they're like, hell no, am I doing that again? And that makes a lot of sense. But when it comes from a fear-based standpoint, that can be a huge bummer. That can be awful. It can impact attachment with the baby. Untreated, by the way, is what I'm talking about for everyone that just had a shame bath. Untreated perinatal mood and anxiety disorder symptoms can absolutely impact attachment with a baby, whether it's the numbing out and detachment or not connecting in terms of like looking at the baby, reading to the baby, talking to the baby, or sometimes overshooting the mark and being so hypervigilant that not letting anyone else hold that baby, not letting anybody else help because it feels super unsafe to do so, checking the baby through the night, constantly being vigilant about breathing, etc. It also can impact relationships. Relationships with a partner can be really challenging afterwards. Relationships with family members, functioning can be impacted. We have tons of studies that show, for example, longer personal leaves taken because, of course, functioning gets impacted and you're not able to go back to work. There are so many negative impacts for people who have untreated perinatal mood and anxiety disorder. So like I said, that was a negative. The positive is, just to remind you, this stuff is treatable. And so even if you're listening and you're like, well, shoot, that is me, and it's been 9 months of this, or it's been 2 years of this, it's never, ever too late. And so if you're hearing me talk about some of these impacts, like maybe this has impacted my relationship with my baby, that is never too late. Bonding is not a one and done at the moment of birth thing. It's an ongoing relationship, or maybe your relationship with your partner or your family members or your functioning has been impacted. None of this is over and done with. You can always heal. There's always an opportunity for change. So yeah, I want to end it on that positive note, that question that you asked me, because
thank you. We like positive notes.
Absolutely can be. Yeah, I think so too.
And just if you're listening to this podcast and you're not pregnant, or you've had your baby and you have heard a friend that has had a traumatic birth experience and they talk about their birth story over and over and over and over, or it's a sister or your mother, whatever. Beth, can you talk about why we do that when we've had a traumatic experience, why we just can't shut up about it? Because I know we can do that with a positive experience too, but it seems like it's heavier when it's a negative one, because everyone that will listen gets to hear it twice, 3 times, 5 times.
Yes. Yeah, that's not your fault. That's a trauma response. I find that there tend to be those two extremes of either, quote, oversharing. I'm not blaming you for that. I'm just more describing it. That idea of oversharing, meaning that you might share your birth story with the cashier at Target, and then as you're driving home, you're like, why the hell did I do that? Or oversharing, meaning that you told more of your story than you would have wanted to somebody, or doing it over and over, hoping to find relief, and you're not getting the relief that you would want. Or the opposite can be true too, from a trauma response of feeling numbed out or disconnected from your story, that there are parts of it that feel unsafe to touch or even look at. That idea of like, if I talk about that, I don't trust myself, then I'm not going to lose it completely. Or if I start to talk about that, maybe people don't name it as a flashback, but that idea of I'm going to feel like I'm still there. It's too raw. It's too emotional. So there's kind of those two extremes of trauma responses for people and for survivors of reproductive trauma. It's that lack of discernment is really common. And so part of healing is also finding more and more safety in your story. Being able to tell your story with discernment, meaning, oh, this is a safe girlfriend of mine. I can tell her what happened to me versus, oh yeah, I know this relative of mine. They're not so good with keeping secrets, or they're pretty brusque with me. So when they ask about how things went, I'm just going to say, oh, thanks for asking. It was pretty rough, but I'm working on that. Early on in your healing journey, you might have been like, whoa, and overshared and then regretted it. It's not your fault if that's the case.
And when we're oversharing, are we looking for relief, or are we looking to clear it out and have it be done? Or are we really just looking for healing with that?
Yeah, I think both things. That idea of wanting relief, but also truly trying to process through what the heck happened. And that's why for some people, storytelling and birth storytelling can be really useful. For people who are experiencing PTSD symptoms, that can often be very activating. And you might find that you're getting stuck in certain parts of your story, or that you are disassociating while talking, or that you're getting really activated or having panic attacks or big emotional reactions. And if that's the case, that does not mean that you've done something wrong or that birth storytelling is wrong. What it means is that you might need a different type of tool for the job, that you might need a different type of healing.
And I guess I have had that in my therapy journey and used EMDR for that to take the sting out of the trauma. I just didn't have with my birth experience, but yeah. And in those traumatic experiences, I did talk about them nonstop. Now I'm realizing and I wasn't discerning. Everybody got it.
Yeah.
Everybody
And again,
got
doesn't
it.
mean there's something wrong with you. It just means you were, quote, trauma dumping is also another thing that I hear people say. That one tends to be very victim blamey, but the reason why I'm putting it in quotes is that's another phrase I've heard. It serves a purpose because you're trying to make sense of it.
So if you could tell us the 3 best things that we should do when we're pregnant or before we're pregnant to get on our road for healing mental health and being aware of what could be happening, will be happening, and stuff like that, what would you say?
That's a good question.
It is a good question. I didn't want to stump you, but that's a good question.
And right at the end, too.
I know, right?
You're making me think. You do not have to have a hard and fast pregnancy and postpartum plan, but I think having some sort of skeletal structure of resources is super duper empowering, because to your point, Care, that idea of when you are in the thick of it, it can be really tough to then rally yourself and search through member services on your insurance card, or think about what is a pelvic floor physical therapist and how would I find that? So even if you don't do like a hard and fast pregnancy and postpartum plan, which they're in both of my books if you need a template, I really recommend that you at least start accumulating some resources. Like, what are some names of doulas that your girlfriends have recommended? What are some therapists that you have searched for in your community, or have that PMHC, the perinatal mental health certification I was telling you about?
Consultants.
What are some good lactation consultants that you've heard of, et cetera? If you need to call on them, then you've already gotten the names ready. If you don't need them, awesome. So that might be one thing. And then what we've already talked about, making an appointment or two with a mental health therapist can be great, very destigmatizing, very empowering. And then it's related, but the idea of rallying the team. Many people don't know this, even though it may sound kind of elementary, but remember, with assigned consent, you can have your treatment providers talk to each other, especially if you're finding yourself getting fatigued of telling your story over and over. So again, your doula can talk to your therapist, can talk to your lactation consultant, can talk to your OB, and you can be empowered to let them know how much or how little you want them to share as well. And that can be really helpful when you've had a history of infertility treatments, pregnancy losses, traumatic birth experience previously, et cetera. It can be really useful to have your team working cohesively.
Yeah, prepare as much as you can for postpartum, because it's the rest of your life. We always just think about, we're just getting a baby out. I'm like, no, there's more. There's so much more. Oh, there's so much more. Well, Beth, where can they find you, and where can they find information on your books?
Oh, thank you. So you can find my 2 books, the Pregnancy and Postpartum Mood Workbook that I wrote with my colleague, Dr. Beth Krieger-Berger, who is just a gem. You can find that one anywhere where books are sold online. And you can also ask for it at your favorite small bookstore. I'm always about trying to support small bookstores as well. And then same with Healing from Reproductive Trauma, my second book that came out last year, that is also available at the same biggies online. And you can ask for it at small bookstores as well. And my website is BethanyWarrenLCSW.com. And I'm also on Instagram, Bethany Warren LCSW. So thanks for asking, and thank you for having me.
Thank you for coming. I hope that families can have a broader view of what mental health is, why it's important, and get some organization done ahead of time, because it'll make a huge difference. So thank you for being here, and we will see everybody next week. Thanks for joining us today. And remember, it's your body, your choice, and finding your voice is your power. Be sure to subscribe to our YouTube channel, follow us in all the places, and go to birtheducationcenter.com for our blog and more online education classes. And we'll see you next week.